Hello, and welcome to the Chief Healthcare Officer podcast. I'm your host, Dr. Fatih Mehmet Gul. Today, we're diving into one of the most urgent and transformative topics in healthcare, generative AI. Somehow it comes as if it's a scary topic, but we will dive into it and we will discuss. While the potential of Gen AI is undeniable, from speeding up clinical decision, reducing administrative burdens, it also brings real questions around readiness, trust, and responsible integration. Joining me today is a leader who has helped shape how clinics and clinicians around the world access to evidence and make decisions. Dr. Peter Bonis, Chief Medical Officer of Wolters Kluwer Health. And I was just discussing with him for more than 2 decades, all my hospitals, it was a privilege actually using his product called UpToDate for our physicians and clinicians, and Lippincode for our nurses, and Lexicon for our pharmacists. We love these products, which are enlightening products, helping the pathways for the clinical decisions. And we really appreciate all this great work, Dr. Peter. So Peter has an incredible background. He trained in internal medicine and gastroenterology, and then co-founded UpToDate from the initial founders, and now leads global clinical strategy at Wolters Kluwer. He has also been leading research and thought leadership around AI adoption in healthcare. Peter, welcome to the show. And to start us off, could you please briefly introduce yourself for our listeners?
It's a pleasure to be here, Fatih. Thank you. And you already just gave me such a generous introduction. I won't belabor that, but this is such an important conversation. I believe that we're at an important inflection point for global healthcare, and I'm really excited to dive into this, what it means really across the Atlantic, because we have so many similar challenges. And as you noted, I am the Chief Medical Officer for Wolters Kluwer. Thank you for acknowledging some of our information services, Lippincode, Lexicon, and UpToDate. We have others too. And as you noted, we serve frontline clinicians and helping them to deliver the best care that they possibly can. And as you noted, I'm also a professor at Tufts Medical School in Gastroenterology, which is my clinical training.
Amazing. Thanks for your time. I really appreciate today. As a physician, I know that it's not easy to know everything. You always need some support. And until recent times, our support was always your product. Whenever we have a patient, the next thing we were doing, we were opening the UpToDate, we were checking the potential codes over there, looking at the potential diagnosis, checking the pathways and everything. And I know that all my doctors, they were having one tab in their computer's browser always open with the UpToDate. And the first thing what I was hearing from our doctors, whenever they join, they were asking, when can you update and activate my UpToDate account? So they just want to have this access. We know that this is an amazing support. But now what I see another tab opened in the browsers, and then there is an AI, generative AI, or some chat modules are over there. So that is something I want to discuss with you. But before just we start, you had a recent survey at Wolters Kluwer looking at the generative AI readiness across the healthcare organizations, covering the frontline clinicians, nurses, IT leaders, and executives. It's a very valuable study. What were the key takeaways from this survey, and did anything particularly surprise you?
Yes. So there are a few major takeaways, although I'm not sure that they were surprising. But particularly what we noticed is the gap between enthusiasm for AI and the readiness for AI among the frontline providers. So we had about 80% of healthcare professionals who cited that optimizing workflow using AI technology is the top organizational goal, but only 63% said that they were prepared to use Gen AI to achieve that goal. And so I think the take home from that is that many organizations are eager to adopt Gen AI to solve the many challenges in health services delivery, but perhaps are underestimating how hard it is to do the necessary steps of integrating that into clinical environments and closing the gap to build sort of meaningful applications into real workflows. We also found a couple of other, perhaps not surprising, but potentially concerning observations. So one is that only 18% of our respondents were being aware of any published policies regarding the use of Gen A by their institutions. Only 42% said that they had aware of any clear processes there. And 76% also reported that they were aware but unfamiliar with regulatory challenges in healthcare policies and practices as a concern for adopting AI. So again, a lot of enthusiasm, but at the front line, there's still a lot of concern about their readiness to adopt these technologies.
I think the AI companies are nowadays faster than the hospitals and then the health systems. I was in LA recently and then met with a couple hospitals and peers. I heard the same thing on the ground. And then I was in Chicago. Then later I visited another group in Dubai. And in my hospital, I hear this similar thing. Now I'm in Istanbul. I met with a couple healthcare leaders and I'm hearing these similar things too. So I think it is a global issue at the moment. And doctors, they want to use it. They're curious, but they're cautious at the same time. So if I may ask, what are the strongest real-world use cases of Gen AI that you are seeing already making the impact over there?
So there is a lot of experimentation, but let me summarize the results of a recent survey, not ours, so this is a separate survey. And this was conducted at the end of 2024, so fairly recent, although the pace of technology is advancing pretty quickly, and included 43 major U.S. healthcare systems. And again, there was discordance between the enthusiasm for the deployment of the AI solutions, and I'll summarize some of what they were, and actually the impact that they were seeing. And just to emphasize, these were the most sophisticated organizations in the United States for it, so really at the leading edge of their capabilities. So Ambient notes, so Ambient Scribes, which is, I think the audience here is probably familiar with. You can just hear a conversation with a patient and then it transcribes it automatically using AI. So there was about 100% of respondents in that survey noted adoption of Ambient Scribe technologies, but only 53% reported a high degree of success with the implementation of those services for it. And similarly, imaging and radiology were also used. So these are not generative AI, but imaging technologies to give a boost to imaging interpretation. So those were also broadly adopted, but only 19% reported that it had unalloyed success. And similarly, many organizations had deployed AI for clinical risk stratification and, for example, sepsis detection, but only 38% reported a high degree of success. The barriers were predictable, so immaturity of the tools themselves. There were financial concerns, there were regulatory concerns and uncertainty. But again, the issue is a gap between expectations and the actual performance when they were deployed in a real world setting.
We're seeing exactly the same thing. I mean, I have been having such solutions in my hospitals, and then we already had them tested by our clinical teams. We're having similar, results out of all these checks. In the teleradiology setup, I had a meeting with my teleradiology company, the partner. They also shared with me this similar thing. But I think, this was expected. We will try them. We will see the problems, and then later on, we will improve them all together. And also, we are seeing the benefit of these solutions. I think the medical legal issues will always remain as a concern about the decision making and then about the results. But then, we don't want to stop the development. We want to be part of the improvement. By saying that, I just want to go to the other side of the coin, the risks. You have already mentioned about the results and then the success rates. Saying that, all excitements and everything, what do you believe are the greatest risks if it is implemented without right structure?
So we could talk about them use case by use case, but I think from the lens of someone who's dedicated his professional life to giving assistance to frontline professionals, and the patients they serve, the risk is ultimately patient harm if these systems don't function in the way that they are intending to. And that's not a theoretical risk. That's a very, very real risk. We'll talk about that when we talk about some of the AI limitations. I think you said that we'll focus on that a bit more. So I think that's a very real concern. I think depending on the health system that listeners exist within, there's another concern is whether or not the emphasis on digital technologies is going to be sufficient to achieve the objectives of the evolution of the healthcare system. So the NHS, for example, in particular, has a 10-year now fit for the future plan. And that has identified, say, Lord Dazi, I think quoting him, said that it is in critical condition and standing at an existential brink. So these are very serious topics, and the expectation is that the digitization of health services is going to achieve a number of benefits in patient care during that time. And so to an extent, if there's a misalignment between the realistic expectations of the benefits and the capabilities to deliver those on scale during that time frame, then we won't actually achieve our objectives in the UK or elsewhere where there's such a dependency on the evolution of these technologies.
So, I mean, definitely, I mean, there are such risks, but you said one thing very well. It's going to make the use or the life easy for those technical solutions. So, similar to the UpToDate, I mean, as a physician who has used UpToDate maybe for last 25 years, always, I mean, I find it sometimes time consuming to find the right diagnosis. And the other thing, maybe, I mean, UpToDate can have an introductory or an initial step from this kind of solutions, which makes our life easier, and then we can start conversating with the solution much easier. So similar to such things, I think will be the solutions what we will see in the coming years, but risks are definitely there. So in our hospital also, we were discussing to set up the AI policy in order to avoid such risks. And we just want to explain to our clinicians and then to all our caregivers which solutions we recommend them to use, which solutions we don't recommend them to use, because some of the use cases and then the stories that we are hearing, people share all the data with them. And unfortunately, this could create some other kind of problems later on, because there are so many AI solutions at the moment available in the market. So for those hospital leaders that, people are hearing us now from Asia, from US, from UK, what are the foundational steps you recommend them to take before bringing the Gen AI into their clinical environments?
It's such an important topic for it. So I think going back to our survey, but really independently of our survey, this is just so much evidence that adequate governance is just imperative for the adoption of all sorts of technologies, and AI included for it. So if there's one thing to do is to understand how the organization is going to make decisions about the adoption of those technologies, to vet them properly. And that doesn't mean one time, because models their performance can vary over time for it. They have to find ways to include them into workflows and define what those workflows are going to be, and to make sure that they're performing according to the expectations for them. There has to be processes in place to ensure compliance with evolving regulations, particularly since the regulations are evolving concurrently with the evolution of the technology itself. And then finally, as our survey emphasized, is to make sure that staff and patients are brought along, that they understand how these technologies work, that they're comfortable with it, that they have adequate training, and also that they understand important limitations where they exist.
Brilliant point. Brilliant point. Thanks so much. I just want to ask another point. Peter, I mean, you're a physician, I'm a physician, and we know that the workload is increasing every single day. The number of patients are increasing. Hospitals are trying to shrink the slots for our examination time, and we need someone to help us. And it looks like AI is going to be the solution. And we want to also encourage our doctors to use this one, and we want to encourage them to build a trust to these solutions. And we know that clinicians, they will try once, twice. If they don't trust, they will not continue to use this. So how do you think, or do you recommend we can bring a trust environment for our clinicians, and we can encourage them to use more such solutions?
It's a very critical point. So earning the trust of frontline clinicians requires a real commitment to align with the ethical standards of care delivery. And in the case of information services such as I'm involved in, to deliver meaningful value to them in their day-to-day work. So they see that and they understand that for it. The level of commitment to earn that trust can be quite significant, and I'm not sure is broadly understood. For example, at Up to Date, we have more than 7,500 contributors who we hand select. These are some of the best people in the world. They're seeing patients. They're the kinds of, they're writing about patients that they see, and they're thought leaders. They're the kinds of people you would want to see or have a family member see if you had that condition for it. They are then supplemented by our internal staff, also who are physicians and who are also specialists themselves. They're trained in evidence-based medicine. They are trained in writing. There is an extensive peer review process and then extensive feedback from our 3 million users who are giving us information about the utility. And then lots of teams of people who are absolutely committed to doing everything we possibly can to delivering a useful piece of trustworthy information that can be applied to the patient sitting in front of you. That's an enormous commitment to get it right, to do that. And that's how come Up to Date and our other information services within Wolters Kluwer have been able to earn trust, because we have that as our North Star and aligning our purpose with the fitness of our services for serving the audience that is so dependent on them. There's another point when I'm talking to the broader vendor community, is that having these kinds of high standards is not just the right ethical posture, but it really is a business imperative, because frontline providers are not going to trust your clock once it strikes 13 for the first time. So you have to have commitment over time to keep doing the right thing and serve your audience well and effectively.
Excellent. And I mean, when I listen you, it is kind of a lesson for the digital health companies and to our large technology partners like Microsoft, Google, and the others. They always want to get the result very fast, and then without spending this much of time. You're telling us 7,500 people and 3 million users and years of work, which brought Up to Date over there. And today, as a physician, I mean, blindly, I trust whatever I read on Up to Date, and I manage all my patients, and I know that it is being updated all the time. And same thing for all my caregivers. So we all appreciate for this work, and I hope technology partners will also understand that, because at the time of COVID, we have seen that so fastly introduced solutions have actually failed after a while, because they couldn't build the trust for the clinicians, for the patients. And today we don't even hear these brands. But I just want to ask one other point. When it comes to the patient side, I remember I was negotiating my first Da Vinci robot in 2008, I guess. And at that time, we made a survey for a large patient population. Are you ready for a robotic surgery? So many people, they were actually not ready for that. So I just want to ask this question to you today about the AI. I mean, do you think patients are ready for AI-assisted care?
So we have done earlier surveys looking on a population level in the United States and asking that very question, and others have as well too. And this shows, as you've just alluded to, that there is some skepticism around AI in the general population. And definitely when we're talking about information services and their caregivers depending on them, there's a desire for transparency in some way, although how that will actually work is not well defined. But there have been many patient-facing AI applications, and actually for many years already. And so it is likely that patient acceptance will just continue to mature as these technologies continue to mature and become practical and reliable for them. So I think we are on that journey collectively as a society. To make a point, though, is we have to address the needs of populations, and digital technologies, AI, and the way that AI could be applied really depends on some foundational familiarity with those types of capabilities. And in the United Kingdom, for example, around 15% of the population is believed not to have those foundational digital tech capabilities. So I think we have to say that these solutions, even at their best, may not fully address the needs of important segments of the population. So another major consideration in driving utility from these technologies across ethical boundaries to create health equity across the health system.
I appreciate. Let's look at the future. Today, we're discussing all these things. I think we're at the beginning of AI era, and you're already meeting with the technology partners. You're on top of the up-to-date and Wolters Kluwer. I'm sure you're having so many discussions. I'm sure my listeners want to hear from you the outlook in 2 to 5 years period. What do you believe will be the most transformative applications of Gen AI in healthcare?
But thank you for asking the question and framing it within a reasonable time frame, because it is very difficult to predict, and particularly when you go further out than that. I always find it much easier to predict what will stay the same in that time frame. But I believe what we'll see is that we'll see the evolution of AI technologies that are focusing on operational efficiency, that are helping patients to navigate and to help their providers to do their jobs more easily. They are already here, so they will continue to get better and continue to get deployed in ways that produce impact and refined. Probably a bumpy journey for that, but I think we're already seeing the types of capabilities that will continue to mature in that 2 to 5 year time horizon. Just to reemphasize a point I made earlier, though, I think the pace of advancement of technology is likely to be faster than the ability to adopt these systems and to achieve that kind of impact we're hoping for on scale.
I totally agree. And I mean, today we're having such discussions, and we're trying to analyze at which touch points of our regular healthcare operation we can implement. And we're having the similar view, but thanks for this vision. I really appreciate that. And we're all curious and we're all excited. So just before we close, let me ask you one thing. I mean, I was always seeing before patients coming to me and telling me that I asked to Google, and Google says to me this, and then what do you recommend? Now we're hearing that I asked to the AI, and then AI tells me this. What do you recommend? Then now the frames and the discussions are changing in our examination room. If I ask to you, what's the one misconception about Gen AI in healthcare that you think we urgently need to address today?
So let me then circle back to some of the comments you made earlier, which is having that other tab open, which is a Gen AI application, which may be one of the frontier models, the hyperscalers, or maybe some of the clinical applications that have been written there. And I want to address the observations that we and others have made about the capabilities of those tools here in 2025, and to also maybe give a little bit of a sneak preview to this audience about how excited we are about using those technologies, but safely and effectively. We will be introducing new capabilities. We already have introduced some AI capabilities into UpToDate, but again, we're doing that extremely cautiously, because the ability to scale up and cause problems if they occur with our 3 million users is quite significant for it. And I'm very excited on the direction that we're heading, because we are going to be able to take advantage of the clinical intelligence, the reasoning capabilities of the 7,500 contributors and peer reviewers that we have, and to use AI to bring those closer to the surface to really help in decision-making in ways that have never before been possible, but to do that without depending on just a machine. to adjudicate complex decisions that occur when you're evaluating a body of knowledge for it. But let me, if you could indulge me, let me just spend a few moments talking about some of the facts around Gen AI when it's used in a high stakes domain, such as clinical decision support or frontline care. So these models are very easy to use and they're compelling. So that chat interface is attractive. It's fast. It has a dialogue. It almost seems magical in how it can sort of address and understand the questions that you're asking it. So there's just an overwhelming temptation to adopt them before the full spectrum of safety is understood. And what we have found and others have found is a number of problems that are quite concerning in this domain. So number one, even experts, so specialists in their area, cannot routinely identify subtle or even grossly incorrect answers that are hallucinated for it. We also have found that search reliability varies between sessions, meaning you search on exactly the same topic, or so it seems, but you get a completely different result for it. That's really problematic in the world of information retrieval. We have seen racial biases in responses to prompt. We've also seen, and others, cognitive biases, which have crept into the prompt responses. Then, the other matter is that the AI generative responses tend to give very crisp and definitive answers, which could sort of be implemented without actually adequate thought. It's sort of like an alert in a way where you simply might just click on the alert without thinking about it or dismiss it. But the point is it leads to what's called automaticity, in which that clinicians sort of do what it says without actually engaging their thought process and applying it to the patient in that very thoughtful way. And then the other piece is that it can deprecate context. So to give an example, since it's a clinical audience out there, I used one of the hyperscaler models and searched on treatment of a urinary tract infection in a patient who had penicillin allergy, and it immediately gave two mistakes. One was it sort of separated fluoroquinolones and then a specific fluoroquinolone into different categories. So that was sort of a more minor mistake, but could lead to confusion. But it gave an answer on an antibiotic choice, but it didn't actually consider whether or not the patient was pregnant. And as some of the audience may know, that fluoroquinolones are probably not a good idea to use in pregnancy because they can be hazardous. So it's that deprecation of context and truly understanding and how a wise and informed clinician would reason to the right choice, which becomes obscured for it. And then there's the last piece of it, which is emerging. It hasn't yet been studied in a healthcare domain yet, but it's been studied elsewhere. So a couple of studies now showing that the reliance on these models tends to reduce the ability to learn and retain that knowledge and impedes sort of the clinical skills or potentially the clinical skills that are necessary by relying on them. So that is potentially a major impact in knowledge acquisition and training and continual learning for it. We haven't seen or studied the impact of all these things. So the concern is that adoption is far outpacing what we understand about safe and effective adoption. So what we're working on is building applications that address all of these concerns. We're very excited about our roadmap. We're not going to be the fastest out there, but we are going to deliver things which take advantage of these technologies and still adhere to our true north and what's been expected to us from the audience that we serve and all the patients that they serve.
I really appreciate this insight, and you're enlightening me. You're enlightening all our listeners today. We should not simply, offer any solution without testing enough, and then without understanding what exactly the data given to this software. Because at the end of the day, these are softwares, and these softwares will only address the points based on which data we feed them. And today we don't know what kind of data is being given. And you're, very rightly saying the point about the magic answers, the conversational types. Yes, definitely there's a temptation over there, but that's something we keep telling to all our clinicians in our hospitals. And then we ask them not to go very fast. Check it, be curious, and then go step by step. So, Peter, I really thank you for your time and then this enlightening discussion. Today, you told us that as the hospital, we need to create our own governance and we need to create the policies. And there is a big gap at the moment in all global hospitals, not in, US or other parts. All of us, this is a big task for the healthcare leaders. We have to work on it, and we should not blindly believe in it, because you shared with us how the up-to-date setup has been created with 7,500 people, all the experts from all around the world, and then they have been feeding the data, they have been checking things. I really appreciate, and it was very balancing discussion. Also, thank you for that. I mean, AI is something we definitely will use, but then we have to be careful because we're healthcare professionals. I mean, we can't simply rely on something that first time we came through, and we have to manage this in a careful way. So thanks for this discussion. And just before we close the conversation, do you have any other point? And I'm very much excited about the up-to-date updates that we're looking forward to see them soon.
No, but I do, I've raised the issues, you've summarized them elegantly. I want to convey that there are so many problems across global healthcare delivery that technology can help with. So it's an incredibly exciting journey. But for those of us who are at the front line or supporting those people at the front line, it means that we have to have that journey with the right guardrails in place as well.
I really appreciate. Thanks for this. Thanks for your time again. My dear listeners and followers, thanks for your time listening us. And please share your comments, and then stay engaged, stay informed. We will be discussing so many topics together with you. And again, thanks, Dr. Bonis. It was a great pleasure meeting with you today. Thanks so much.
Pleasure too.
Thank you, sir.